painful to hear that kind of news from anybody. And I think it's because of the insecurity we have in our nation. A lot of things are actually going wrong.
The situation, maybe illness of those, all those people that are being abducted, they need to bring in medical doctors that will look at them. That's for the people they don't want them to die or something.
The recent kidnappings of over 20 medical students has sparked a national outrage, intensifying the already unsettling state of security in Nigeria. Medical practitioners have increasingly become targets of abduction, with some regaining their freedom, while others, like Dr. Ganiat Upola and her nephew, remain in captivity. These attacks further strain Nigeria's already fragile healthcare system, leaving the medical community deeply concerned about the safety of health workers across the country. We are speaking with Nigerians to hear their thoughts about this urgent matter.
Well, it's painful, sir, for someone who are labored so high in education, and at the end of the day, with some referrals will just pack them and keep somewhere and calling for ransom. So it's not a really good thing to the country.
It's quite disheartening, but you know, it's something that I think the country, we are getting used to people, kidnappers abducting people, and it's quite sad if you come to look at it. It's really, really sad.
Hearing something like that is very bad. In fact, it's very bad. It will even make people to be scared of going to work, coming out, because they will be like thinking, who knows the next person that will be kidnapped, or who knows the next target. Yeah, that's why you see most of our medical doctors, they fly out. When
it comes to this kidnapping thing, I think they are all linked, they are all connected together. Why are they kidnapping doctors? There are other people, there are other individuals, other personnel that are not doctors, medical doctors, that they are kidnapped. I'm very sure because of some situation, maybe illness of those, all those people that are being abducted, they need to bring in medical doctors that will look at them.
Issue that the government should handle properly, because that road is very, is a major road, and it should be dealt with all care in case of these issues. It should not happen again.
Insecurity in Nigeria is a disaster. That is the only way I can quantify it. That is the only one they could report. As we are standing here now, something security is happening somewhere in Enugu or anywhere in Nigeria. So if you are talking of kidnapping, kidnapping is now like a culture in this country.
Well, you and I know that it's obvious they are not even doing anything about it. I'm sorry, but that's just the fact.
We need to strengthen the security architecture of Nigeria. I know it's something that they would say they are working towards that, but if you come to look at, things are even getting worse from the north now to the east, and then some places in the south.
We leave equipment. We have some of this equipment in Nigeria. What rescue have they made? Let's be sincere with ourselves. When you are talking of, say, equipment, what are these equipment? I see those equipment, they use it to loot us. I know you are going to edit all these things.
It's for the government now to mount, even if it's police in every hospital, checkpoints, and police should do their work effectively.
You go to the police station and make a report, they collect your details, and they will transfer it to the criminal. The criminal will start hunting you. That is another issue, Nigerian government. That is why I said the Nigerian police need to overhaul.
Because of the poor salaries, insecurity, in fact, I don't know, lack of facilities, because there are some doctors and nurses that want to do their job, but lack of facilities, they prefer going out there where there's a lot of facilities. That's just the fact about it.
I think, first of all, I think it's still has to do with the kind of country we are in, you know. And the best way we can do that is somehow probably pay them well to ensure that they are able to, you know, some of them can get their self-cars and all that. You know, when you drive yourself, at least you can easily maneuver places where you feel like they are not safe.
As well, we need to watch out for each other. That's another way we can actually strengthen our security.
The safety of our health workers is crucial to the well-being of our community, and protecting them should be a national priority.